It's Mari McInerney from Croakey here, and I'm speaking with Romlie Mokak from the Lowitja Institute.
That's right.
Romlie, can you give me a little bit of a background about yourself, including where you were born and raised and where you've worked?
Yeah, sure, Mari. So my family from Broome originally. We're Jugan, and I'm a member of the Yaru peoples. But I was born in Darwin, so on the lands of the Larrakia people, and grew up for the first 10 or so years in a place called Adelaide River. Adelaide River being about an hour south of Darwin, lands of the Gunarakan people. Back to Darwin, cut a long story short, I spent some time in Armidale in New South Wales, so that's the Arnawan people, on the lands of the Eora after I graduated university, and then over the last 17 or so years in Canberra, the Ngunnawal and Ngambri people. I'm currently working in Melbourne, and this is the Kulin Nations here. The Wurundjeri people are the clan that are, where we're located here at the Lowitja Institute.
And can you tell me a little bit about the Lowitja Institute for people who don't know it?
So we're the National Institute for Aboriginal and Torres Strait Islander Health Research. We're based here. We were established in 2010 after about 15 or so years of a model called a Cooperative Research Centre model. So these are arrangements where we get researchers, policymakers and Aboriginal organisations together working out what the priorities might be, and then conducting research around that. So the Institute, we had the name gifted to us by Lowtja O'Donoghue herself. People would know Lowitja. She's people often refer to Lowitja as the closest we get, ironically, to kind of queen or the head of state in our world. A brave, amazing woman who has just had such a fierce and clear focus on social justice for our people. So Lowitja gifted her name, and in gifting her name to the Institute, she essentially said, I want you to get on with the job of going beyond the words and putting that to action, being courageous, doing things for our people, for the benefit of our people. So this is what the Lowitja Institute's about, and we do that through a partnership with many. Our CRC, our Cooperative Research Centre, has 22 partners, medical research institutes, universities, governments, Aboriginal organisations. And the Lowitja Institute itself, as the governing body, has all of the national peak organisations for Aboriginal and Torres Strait Islander health and wellbeing. So that's kind of, if you like, the kind of governance and the structure of the Institute. But more than anything, we really want to drive change for our people. We're a black organisation, an Indigenous organisation in this country. We're not a research unit within an institution, within an academic institution, and that's really where we will go with this agenda as an Indigenous organisation.
We're here to talk about your biennial conference coming up, but if you could just briefly talk about what is different about the way Lowitja actually approaches research and why it was important to have an Indigenous research organisation, particularly in health.
Well, it's fundamental to our future. So in the early days when we commenced as a cooperative research centre, there was a great deal of scepticism about the motivations of researchers and their institutions. So it was the community controlled health sector, and we know how critical our Aboriginal community controlled health services are to our people. But it was a sector who's essentially said, well, let's try and balance up the power here. So if we're going to do research together, let's do it as equals, as partners, and have Indigenous people set the priorities, rather than having researchers, through their researcher-driven agendas, come in and then kind of seek permission from our mob. So this is now, after about nearly 20 years, encapsulated in the Lowtija Institute. So it's about Aboriginal and Torres Strait Islander leadership. It's about us setting the research priorities. It's about growing our own Indigenous researchers in this country. We have a very extensive scholarship program. It's about being able to leverage as an Aboriginal Torres Strait Islander organisation in those conversations with others to shift the agenda and to put our perspectives, Indigenous perspectives, front and centre on the table.
So that all gets showcased now at your conference. So it's the theme is identity, knowledge and strength. I'm interested to hear about who you've got coming up and what sessions you would like to highlight.
Well, they are the three themes, and we landed on those because they're very much a part of what the future looks like. You know, our identities are constantly being constructed by others, so we need to do that and be stronger in that ourselves. The knowledge theme is really about saying that our science has been around forever, well preceded Western constructs of science. So how we understand those knowledge systems and that science is critical to our future as well, and how we negotiate with the scientific endeavour, the Western methodological approach. And then strength, obviously, you know, we've, as Indigenous peoples of the world, survived genocide. It takes a great deal for people to come out of that, and we need that strength to go forward.
There's a very global perspective to this
conference.
You have many keynote speakers from Indigenous communities from Norway through to New Zealand. Can you talk about who they are and what you're hoping to hear from them?
Absolutely. Now, we identified 6 keynote speakers initially. And this is our first international conference, the Lowtija Institute's first international conference, so the level of support has been tremendous. 5 of those keynotes came back with an agreement, a willingness to share this space with us. That's the level of support. Now these people are, the opening keynote is Megan Davis. So Meg is a Gubbi woman, constitutional lawyer here from Australia. More recently has been the chair of the United Nations Permanent Forum on Indigenous Issues. So that's Megan. We have Moana Jackson, a Māori lawyer, but a legend in that space. And Moana has an international profile. The fact that he could come here and share his offer his teachings and learnings to us is fantastic. Chief Wilton Littlechild, we're particularly keen to have Willie Littlechild join us because he was one of 3 commissioners on the Canadian Truth and Reconciliation Commission. Now, there's a discourse in this country where proper reconciliation requires the truth. So we're keen to understand how the Canadian experience may or may not be comparable to ours. So the question of truth is fundamental to the exercise. And Willie Littlechild was one of those commissioners. The Commission handed down, I think, their final report late last year. So we've got some very current learnings and understandings from that. Karina Walters is a Choctaw Nation of Oklahoma Native American researcher, amazing researcher, currently a director of an Indigenous Wellness Institute at the University of Washington in Seattle. And we're very excited to have all the way from the very north of Norway an Indigenous colleague in Gun Hedda. Now, Gun Hedda is a Sami woman, and she heads up the only Sami mental health drug and alcohol service in Norway. I visited that service back in 2012 and was really struck with a very simple statement, which was people come in Norwegian, but they leave the service Sami. You know, really powerful. So Gun will deliver that model of service delivery to us.
And what about other sessions there, because there is such a huge research focus? Anything particular that you can highlight? And I know you're involved in also, there's the Lancet, the latest Lancet collaboration.
It's a busy schedule, but it's fantastic.
It is busy. It's 7 concurrent sessions.
This is. I mean, we were overwhelmed. This being our first international conference, but with these things, you always take a bit of a punt. Now, we thought we might achieve 150, 200 abstracts, for example, when we put the call out. We got 325, if I've got the numbers correct, over 300 abstracts. That was the level of interest. So we do have a lot of sessions. We've got these amazing keynotes, but we also have some parallel meetings as well. One really critical one, and I'm very proud of this piece of work with the Lancet. The Lancet journal is probably one of the top 2 medical journals in the world. And the Lancet has collaborated with the Lowtija Institute, a study led by Professor Ian Anderson from the University of Melbourne. And it's a study which looks at how Indigenous peoples of the world are tracking in comparison to the wider population. And in the main, Indigenous peoples are behind. There is that gap right across the world. So we're having and that report was launched back in April, a seminal report, landmark report, never been done before. So we're having collaborators come in from all over the globe. India, for example, India has over 100 million Indigenous and tribal peoples. It's phenomenal. So we have an Indian collaborator, Professor Bang, coming out to join us, as with others from New Zealand and Canada and the US. Now that it's not my hope, it's my determination that that report is not a one-off. I would want for us to continue the collaboration with the Lancet and conduct the study in 5 years' time, for example. And I'll be looking not necessarily to go to government for money to support that report. It's a global exercise. 23 countries, 28 Indigenous populations, so big piece of work. But I'll be looking for supporters to come on board with us to fund that. I think it's that significant. So that's one of the important parallel meetings. But it is a busy agenda. Look, it's hard to identify anything specifically because it's just such a rich agenda. We have traditional healing practices, all the way through to big discussions about the very question of identification. If Indigenous peoples of the world aren't even counted, how the hell can we get to understand whether we're going forward, backward, improving or not? So these are fundamental questions. In Australia here we have we've got variable data, but we do okay compared to the rest of the world.
In terms of data collection? In
terms of data collection. I mean, we're behind in a number of areas, but as a comparator. Some of you'll hear, delegates will hear Gun Heta speak, and she will speak to the question of the kind of nuance in Norway for Sami people. And Sami people have similar life expectancy, similar education levels, particularly for women, but they have to fight for their identity and their culture and their language. So the way that they are counted is not the way that we're counted, through self-identification. It's through geography, or I think it's to do with language spoken, but not about self-identity. So these are big questions for the global community, for the UN and others to really seriously take these points up from Indigenous people. So that's a big one. Right down to, how do we get better services for our mob on the ground, whether Māori, Native American, First Nations, Sami. We have some people speaking about work in Brazil as well and elsewhere. So how do we take knowledge and research and actually make it real? Essentially that's the guts of the enterprise for the Lowtja Institute, not about the research itself, but about, what do we do with that for benefit for our people, both here as well as overseas.
We're really looking forward to covering the conference at Croakey. Sounds fantastic.
Oh, look, we're it's been a big piece of work, but what I'm just thrilled with is just this level of support that we've got. We will have in the room people working as practitioners on the ground, community researchers. We have the Yalu research group coming from Galwinku. We have traditional healers from Nanangu, Pitjantjatjara, Yankunytjatjara lands through the NPY Women's Council. We have amazing Hawaiian practitioners who are scholars as well. But the platform upon which we're operating and building on is an Indigenous bedrock. So that's what we want. We want to share this space with our non-Indigenous colleagues, but it's an Indigenous conference, and you will see that, and more than that, you'll feel it, I think.
Fantastic. Thank you, Romlie.